Hi, my name is Norgestrel. This is me. In the US, my brand name is Griselle or Norgestrel. Beautiful name, right? Just like me. In the Philippines, I am known as Norfem and Norgestrel. This is my chemical name, and I hate it. Therapeutically classified as an oral contraceptive and pharmacologically classified as progesterone. I am intended to prevent pregnancy and should not be consumed by pregnant women. That is why I am in pregnant category X. I am often referred to as mini pill because I do not contain any estrogen. I am from progesterone, which is a hormone that prevents pregnancy. How do I do that? I tie to the progesterone and estrogen receptors inside the female reproductive system, the mammary organ, the nerve center, and the pituitary gland. When I am bound to the receptor, I will slow the recurrence of release of gonadotropin-releasing hormone from the nerve center and slow the pre-ovulatory surge. The loss of the LH flood represses ovulation and in this manner prevents pregnancy. I am well absorbed from GI tract. I am highly protein-bound to albumin with a volume distribution of 162.2 liters. I am metabolized in liver to sulfate and glucuronide conjugates. I am contraindicated to pregnant women, patients who are hypersensitive to drugs, has thromboembolic disorders, and cerebral apoplexy. History of these conditions: breast cancer, abnormal vaginal bleeding, severe hepatic disease, and missed abortion. I also have side effects. Integumentary system: skin rash, itching, hives, yellowing of skin. Central nervous system: severe headache, weakness, vision, speech problem, yellowing of eyes, mood swings, hemorrhage, and depression. Endocrine system: breast tenderness, changes in sexual desire, facial hair growth, and weight gain. Digestive system: pain in the abdomen, nausea, and vomiting. Urinary system: dysmenorrhea, fluid retention, bleeding, vaginal candidiasis. Respiratory system: shortness of breath, pain in the chest. Reproductive system: changes in menstrual flow. Cardiovascular system: hypertension, edema, and pulmonary embolism. I am only prescribed by the doctor because he or she has judged that the benefit to the patient is greater than the risk of side effects. Wow! All that information makes me tired. I'll hand this over to Nurse Jay since I'm going to bed. Bye, women!
A few moments later.
Hi there, I am Nurse J. I'm sorry you have experienced some technical difficulties, but now I will introduce you to the nursing interventions. Before I administer Norgestrel, I need to assess the client if they are hypersensitive or has allergies because Norgestrel may contain inactive ingredients which can cause allergic reactions or other problems. I also need to assess medical history including family medical history, especially of abnormal breast exam, breast cancer, liver problems, unexplained vaginal bleeding, asthma, and other relevant tests. I also need to assess cardiovascular status including hypertension, history of myocardial infarction, cerebrovascular accident, or thromboembolic disease. Also, I need to encourage client not to smoke. Smoking cigarettes or using tobacco while using the drug increases the risk of heart problems and stroke. Rule out pregnancy before therapy is begun. While the client is on therapy, I need to monitor client's knowledge level of proper administration because incorrect use may lead to pregnancy. I also need to tell the patient the importance of having regular, annual physical exam to check for adverse effects or developing contraindications. I also need to advise the patient to report all drugs and supplements she is taking, as some can decrease the drug's effectiveness. A backup contraceptive method may be needed. I also need to check the blood pressure periodically. Drug-induced blood pressure elevation is usually reversible with the cessation of Norgestrel. I also need to monitor vision changes because progestin can alter fluid in the eye and the curvature of the cornea. Monitor for fluid imbalance because progestin can cause fluid retention. Monitor integumentary effects because Norgestrel has tons of adverse effects. After administering the drug, I need to instruct the client to immediately report signs of possible cardiac problems such as chest pain, dyspnea, edema, tachycardia, bradycardia, and palpitations. I also need to instruct the client to report symptoms of hypertension such as headache, flushing, fatigue, dizziness, palpitations, tachycardia, or nosebleeds. She must discontinue medication and notify the healthcare provider if significant bleeding occurs at mid-cycle. I also need to instruct her to take a missed dose as soon as remembered, or take 2 tablets the next day. If 3 consecutive tablets are missed, begin a new compact of tablets, starting 7 days after last tablet was taken. And she must contact the healthcare provider if 2 consecutive periods are missed, because pregnancy may have occurred. I also need to instruct the client to schedule annual pap smears. Instruct the client to perform monthly self-breast exams and obtain routine mammograms as recommended by the healthcare provider. Well, that's all for today. See you in the next episode. Bye!